heard people say, at least you have your health.
Yeah.
Especially when life takes a turn for the worse or you're just having a bad day. Well, what about those people who do not have their health because they suffered from a terminal illness, relatively unheard of, that affects the immune system called sarcoidosis? Sarcoidosis and neurosarcoidosis affect people between the ages of 20 and 40 years old, according to the National Institute of Health. Although men and women can be affected, women are more likely to develop symptoms, and African American women are affected more, according to the information from the website medline.com. The lungs are mostly affected, but other organs can be affected as well. Vision and hearing impairments can also occur, as with neuro, as it affects the brain and nervous system. Sarcoidosis is often called the mimic disease because it mimics other diseases so much so many are often misdiagnosed, missing out on key and important treatments. This disease is something that is close to me because my best friend of almost 30 years has suffered with it for almost 8 years now. Since losing her vision back in 2008, she slowly became totally disabled and was often given a diagnosis of MS prior to being told, in fact, it was neurosarcoidosis. Today I'm going to talk to you about some of the symptoms as well as some of the treatments of sarcoidosis. But first, let's take a look at some of the famous people you may recognize that have suffered with the disease. Comedian Bernie Mac suffered from sarcoidosis. He died from complications back in 2008. The disease primarily affected his lungs, and ultimately he died from pneumonia. Another person you may recognize is NFL player Reggie White. He died back in 2004 after suffering with lung and cardiac sarcoidosis for many years. Actress and MTV VJ Karen Duffy. She's still living and she suffers with sarcoidosis, which is affecting her brain, and she often writes about it and has published many books on the issue. The National Institute of Health defines sarcoidosis as a chronic inflammatory disorder. So it's a development of sarcoidosis in the nervous system when one is diagnosed with neurosarcoidosis. According to the National Institute of Health, there is no known cause. Sarcoidosis occurs when the immune system basically attacks itself when abnormal cell deposits in any part of the nervous system, including the brain or spinal cord. So what are some of the symptoms? Well, symptoms can include extreme fatigue and thirst, frequent urination, confusion, dizziness, headache, and ultimately delirium or dementia. Although there is more research to be done and no known cure, there are a few treatments that are being known to lessen the symptoms and ease the progression of the disease. According to the Mayo Clinic, hormone replacement therapy can be used to suppress the immune system. Steroids also work to reduce inflammation and control some of the symptoms. Additional treatments may include pain and weakness, medication for pain and weakness in the limbs, and medication for depression, as well as physical therapy. Some people may recover after 4 to 6 months. Ultimately, it is not a good prognosis. Many people get progressively worse, leading to total disability and eventually death. It depends on what organs are affected with this disease. So what can you do? Well, if you're in that zone of African American woman between the ages of 20 and 40, meeting with your MD and getting treatments if you notice you have an improperly functioning immune system is key to stabilizing your symptoms to a road of recovery. The National Institute of Neurological Disorders and the National Institute of Health have partnered together to find not only the underlying cause of sarcoidosis, but to find ways to better treat and ultimately cure sarcoidosis. Thank you.
Thank you.